A pleasant day to everyone. Please join us for our presentation on the topic gene therapy. In this presentation, we will discuss gene therapy and its various forms, assess the issues, potential benefits, and detriments to global health. We will also discuss the in vitro fertilization and surrogacy. And lastly, we will discuss some individuals who undergo gene therapy. I'm Rachel Gomez, and here are my fellow members to help me discuss gene therapy.
I am Lawrence Garcia.
My name is Jonathan Flores Pimentel.
This is Altea Espinosa Garcia.
I'm Deborah Perez.
John Paul Valdez from BSIT 1H.
Understanding gene therapy. Gene therapy is a technique that utilizes genes to treat or prevent disease. Gene therapy involves inserting genes into a person's cells with the purpose of providing treatment for a certain ailment. Generally, a healthy and normal gene is implanted into a cell or tissue to substitute an abnormal gene and which causes disease. There are techniques in order to deliver the gene which may be difficult and require some factors like to carry the normal gene into the cell. There are some of the approaches in gene therapy. First, an altered gene that causes disease is replaced with a healthy copy of the gene. Second, a mutated gene that functions improperly is inactivated or knocked out. And lastly, a new gene is introduced into the body to help fight a disease.
Gene therapy and stem cells. Stem cells hold great potential in gene therapy. One of the best characteristics of stem cells is that they have the capacity to self-renew. Hematopoietic stem cells are a best choice because they can easily be obtained from the blood, bone marrow, or umbilical cord. Stem cells are cells of variable potency that has the capacity to self-renew. Stem cells can be both self-renew or make copies of themselves and differentiate the other types of cells, specialized cells of the body. If a cell becomes specialized or differentiated, it plays vital roles in the body, such as blood cells, nerve cells, and muscle cells. This makes stem cells very important since body needs stem cells to replace specialized cells that are damaged or get used up and even die. Self-renewal is necessary because if the stem cells cannot make copies of themselves, their supply may quickly run out. It's a key for the body to preserve a pool of stem cells to use throughout life. Differentiation. It is essential because specialized cells are used up, damaged or die continually during our lifetime. Stem cells can give rise to specialized cells. These specialized cells cannot make copies of themselves once worn out. However, they can be replaced in the body through stem cells to still carry out its functions. Stem cells jargons. Potency refers to the number of possible fates that a cell could acquire. Totipotent, all fates zygote. Multipotent, pluripotent, many fates but not all fates. Bipotent and unipotent, one or two fates.
There are 4 types of stem cells that we will discuss, and the first one is embryonic stem cells. ESCs are obtained from the blastocyst, which is very early stage embryo. The blastocyst consists of the inner cell mass, an outer layer of cells, and a fluid-filled space. The inner cell mass is the group of cells where the ES is derived. Embryonic stem cells are promising because they are pluripotent and thus can make all the different types of cells in the body. Some are other facts about ES. ES are extracted from frozen embryos left over in vitro fertilization. Grow out as ESC lines. Each lines have unique potency. Embryonic stem cells pose ethical concerns regarding their extraction and harvesting, as they are part of human embryos. Non-autologous matches may result in graft rejection if the recipient's immune system doesn't match the ESC line. ES has the potential to generate all cell types in the body, with no restrictions on organ generation. It can also renew endlessly, allowing a single cell line with carefully characterized traits to generate almost limitless numbers of cells. However, there are some identified disadvantages of embryonic stem cells, and here are some identified disadvantages. Some identified disadvantages are as follows: difficult to culture and grow slowly. Cells tend to develop abnormal karyotypes and other abnormalities. ES cells have the potential to form teratomas if all cells are not committed to the desired cell types before transplantation. Ethically controversial.
Under embryonic stem cells is in vitro fertilization. What is in vitro fertilization or IVF? IVF or in vitro fertilization is a process in which couples' gametes are fertilized outside of their body in a laboratory. This procedure is generally performed in a test tube, hence known as a test tube baby. In IVF, the mother was provided with some hormonal pills in order to elevate the development of eggs in her ovary. After a mother produces a good quantity of mature eggs, then, with the help of a simple process, the eggs are collected in a test tube and are combined with the partner's sperm to initiate the fertilization process. After days of close observation, the doctor selects a few fertilized eggs and implants them into the mother's womb. Success rate of IVF. The success rate of IVF depends on the age of the patient, as usually the success rate of IVF treatment declines with subsequent age.
Surrogacy. Surrogacy is a procedure where fertilized eggs are implanted in another woman, known as surrogate, who agrees to carry the baby for 9 months and deliver it to its parents. Unlike IVF, which means in vitro fertilization, surrogacy is more complex due to financial, emotional, and legal factors. The success rate of surrogacy is typically 75 to 80%, but at fertility clinics, the success rate is 85% due to the team's understanding of the importance of motherhood. The surrogate is not genetically related to the child and is more complex than IVF.
Adult stem cells, ASCs. ASCs or tissue stem cells can often make several kinds of specialized cells, but they are more limited than embryonic stem cells. Adult stem cells are considered multipotent because they can become multiple types of specialized cells, but not all the kinds of cell in your body.
In thus pluripotent stem cells, Dr. Charles A. Goldway Jr. reported in 2006 that researchers at Kyoto University in Japan discovered conditions that could genetically reprogram specialized adult cells into a stem cell-like state. iPSCs are reprogrammed to an embryonic stem cell-like state by introducing genes important for maintaining the essential properties of embryonic stem cells. Same as embryonic stem cells, iPSCs are pluripotent and can make all the different types of cells in the body. Turning adult cells into thus pluripotent stem cells involves adding particular genes to cells in the body to make them behave like embryonic stem cells. This process is analogous to changing the instruction in a computer program to make the computer do a different task. Researchers anticipate the use of iPSCs can help treat diseases like Parkinson's or Alzheimer's in the future.
Umbilical cord stem cells. Stem cells can be obtained postnatally from umbilical cord including the umbilical cord blood cells, amnion, placenta, umbilical cord vein, or umbilical cord matrix cells. This source is readily available and inexpensive, which are multipotent and are capable of forming many different cell types. Donated cord blood that meets requirements is frozen and stored at a cord blood bank for future use 10 years. Induced pluripotent and umbilical cord stem cells used in gene therapies. Though there are a lot of ethical controversies regarding the source where stem cells are obtained and the technique per session, there are persistent endeavors in researchers conducted to establish the potentials of stem cells for treating diseases and prolong.
For the last part of our topic, we've researched some example who had undergo gene therapy, and the first one is Yusuf Said, an 8-year-old boy on Long Island, is making medical history as the first patient in New York to undergo gene therapy treatment for a rare genetic disease known as thalassemia. The 8-year-old was born with a rare genetic blood disorder called thalassemia. This means his body does not produce enough hemoglobin, a vital component of red blood cells, according to the Centers for Disease Control and Prevention. Yusuf, despite having a twin sister, didn't have a suitable donor for a transplant. So instead, doctors opted for newly approved and transformative gene therapy treatment. Yusuf was the first patient in New York to receive this infusion. He spent 6 weeks in the hospital. In that time, he underwent chemotherapy to make room for new cells. Doctors hope to use this gene treatment to prevent, treat, or cure certain hereditary diseases, including sickle cell anemia.
Ashanti D. Silva. In 1989, Ashanti, a 4-year-old girl with adenosine deaminase deficiency, was diagnosed with severe chronic inflammatory bowel disease. Without a groundbreaking change in the way Ada was treated, she would never reach adulthood. To boost her T-cell count, however, after 2 years, Ashanti was no longer responding to the treatment. Ashanti D. Silva. In 1989, Ashanti, a 4-year-old girl with adenosine deaminase deficiency, was diagnosed with severe chronic inflammatory bowel disease, who was lobbying for permission to move forward with human gene therapy trials. In 1990, Ashanti parents Rock and Van De Silva connected with geneticist French Anderson. Anderson's clinical trial applied the technique of manipulating a virus to carry a corrective gene into patients. And after the strenuous approval process, Anderson received permission to move forward. Ashanti's parents were fortunate to be in the right place at the right time and gave permission to their daughter to be implanted with the corrected gene. Her health taking a remarkable uptick over the following 2 years and no significant side effect. The result of Anderson's clinical trial were astonishing, with Ashanti's T-cell count going vertical over the first 6 months. The trial added other patients, and in just 3 months, another young girl underwent successful treatment. although doctor opted to continue PEG-ADA injection at a modest rate. Ashanti was able to attend school with other children and live a relatively normal life.
Tedesco, a 19-month-old girl from Northumberland, has become the first person to be cured on the NHS with a revolutionary gene therapy, Libmeldy. Tedesco was diagnosed with metachromatic leukodystrophy, an inherited condition that causes catastrophic damage to the nervous system and organs. The 19-month-old girl is now disease-free after being treated with the world's most expensive drug, Libmeldy. NHS England reached an agreement with its maker, Orchard Therapeutics, to offer it to patients at a significant discount from its list price of £2.8 million. Libmeldy corrects the genetic cause of MLD by inserting functional copies of a faulty gene into the patient's stem cells. The drug, delivered as one of intravenous infusion, must be given before the irreversible damage caused by the disease progressed too far, according to guidance from the National Institute for Health and Care Excellence.
Jojo Stagg. Shanti Stagg and Jamil Stagg discovered their son Jojo had an ultra-rare genetic condition called aromatic L-amino acid decarboxylase deficiency, which prevents children from creating enough enzyme to regulate brain and nervous system functions. The disease affects about 150 children worldwide and prevents them from controlling their bodies and walking or talking. After years of struggle, hope for the Staggs and other parents of children with AADC deficiency emerged in the form of experimental gene therapy. A research team led by Crystal Bankiewicz developed a novel method to treat children with AADC. The deficiency, giving them many of the motor skills they were born without. Within a few months, Jojo's oculogyric crisis stopped and he began to walk, control of some muscle today. The Staggs are working with Jojo to help him walk independently, learn to eat independently, and improve his communication abilities.
And lastly, William Jr. William Jr. was healthy and reaching expected developmental milestones. However, at 9 months old, William showed little interest in moving or crawling and struggled to support his own body weight. At 1, he still struggled with crawling, walking, and sitting up. The family's pediatrician recommended early intervention, but after months of no improvement, the family was referred to the Division of Neurology at Children's Hospital of Philadelphia, or CHOP. The pediatrician diagnosed William with spinal muscular atrophy, or SMA, a progressive neuromuscular disorder that destroys muscle-controlling nerve cells called motor neurons. SMA can affect a child's ability to crawl, walk, sit up, and control head movements, as well as damage muscles used for breathing and swallowing. William was diagnosed with SMA type 2, which can lead to feeding and respiratory issues. Within a month of receiving the one-time dose of gene therapy, William was able to lift up his arms over his head and bear weight on his legs. And that's it, our topic. I hope you learned from us, and thank you for your patience of joining in our presentation. Have a nice and gracious day!